most important part of any vision screening program is the opportunity to connect each community member with a free health coverage program so that they can receive a complete eye exam by an eye doctor. The visual acuity screening itself is not important. As you know, even if they have a perfect 20/20 vision according to the visual acuity screening, they could still have an eye disease that could lead to blindness. Therefore, everyone that you encounter needs to be connected with a free health coverage program so that they can have a dilated eye exam by an eye doctor. This video will demonstrate for you a series of examples regarding how to connect community members with free health coverage programs. First, you will have the community member complete the background information form. You will use the information on this form to properly match them with free health coverage programs. You need to memorize the details for free health coverage programs so that you can accurately and effectively connect each person with these programs. The Vision USA applications are for people who work at least part-time, have not had an eye exam in the last 2 years, and have no insurance that covers eye care. If a person qualifies for Vision USA, and if it's between 7 a.m. and 7 p.m. Central Time, they should immediately call the Vision USA 800 number either on the community center's phone or on your cell phone. Eye Care America is for U.S. citizens, and there are several different types of programs. One is for senior citizens who have not been to an ophthalmologist in at least 3 years and who do not have insurance that covers eye care. Another is for senior citizens with diabetes who have not been to an ophthalmologist in at least 3 years and who also don't have insurance that covers eye care. A third is for people at risk for glaucoma, based on family history, race, and age. They also must not have been to an ophthalmologist in at least 1 year and cannot have eye insurance that covers eye exams. Eye Care America is open 24 hours a day, 7 days a week, so if someone seems like he or she would qualify for an Eye Care America program, you should have him or her call the 800 number either on the community center's phone or your cell phone. Now let's review a couple of scenarios you might encounter while working out in the field. It is a Saturday afternoon and you're doing visual acuity screenings for a female community member who is 40 years of age with no vision insurance and has not had an eye exam in over 2 years. She is a U.S. citizen and has a family history of glaucoma. She doesn't work, but her husband is currently working part-time. The household is low income and unable to pay for eye exams. What free healthcare services could you connect this person to, and how would you go about connecting her? You should try connecting this person with as many resources as possible so that she has the best chance of receiving an eye exam by an eye doctor for free. This person is a U.S. citizen with low income, and someone in her family is working. Because of this, she may qualify for Vision USA. If Vision USA were open, you would have her call on your cell phone. However, it is a Saturday, and you know that Vision USA is open only Monday to Friday from 7 a.m. to 7 p.m. Central Time. In this case, you can give the community member a paper application for Vision USA. On this application, she will simply have to put check marks yes or no to several questions. This application can then be faxed by you, the Unite for Sight volunteer, to Vision USA. Never let the community member take the application home because you want to be sure that Vision USA receives the forms that eye care can be provided. You must be sure that the form doesn't get lost or forgotten. Did you also notice that the person has a family history of glaucoma? This means that she may qualify for Eye Care America glaucoma. She's a U.S. citizen or legal resident, hasn't had an eye exam in 12 months or more, and meets the risk factor of family history. She also does not have insurance. Since Eye Care America is open 24 hours a day, 7 days a week, simply have her call the 800 number to speak to the Eye Care America representative on the phone. Is there a free eye clinic not too far away? You should also let this person know where this clinic is located. She might choose to go to the clinic for her eye care or to use the clinic for another health matter now that you've made her aware of the free services at the clinic. Let's review another scenario. A community member has just had his visual acuity screening, and the screening shows that his visual acuity is 20/20. You look at his background form and see that he is 70 years old and is a legal resident. He has not seen an eye doctor in over 5 years and he has no insurance. He lives alone and is not working. He is in good health. What do you do? He has 20/20 distance vision, but this does not mean that you should skip the most important part of the community program. He hasn't had an eye exam in 5 years, and many eye diseases gradually affect vision in a way that cannot be detected by visual acuity screening alone. He is a legal resident and over 65 years of age, and hasn't had an eye exam in 3 or more years. Additionally, he doesn't belong to an HMO or the VA. Thus, he should qualify for Eye Care America for seniors. Simply have the man call Eye Care America on the toll-free 800 number from your cell phone so he can get connected with Eye Care America for seniors. You should also tell this man about any free clinics in the area that do eye care as an additional option. Let's take another scenario, for example. It is a Friday morning and a female community member has had her visual acuity screening done. You look at her background form and see that she is 67 years of age and has diabetes. She writes that she hasn't seen an eye doctor in 3 years and that she has no insurance. She is working part-time at a local grocery store but does have a limited income. She is also a U.S. citizen. Since she is at least 65 and a U.S. citizen with diabetes who hasn't seen a doctor in 3 years and has no insurance, she will qualify for Eye Care America for diabetes. Simply give her the 800 number for Eye Care America and have her speak to the representative. Can she be connected with any other programs? What about Vision USA? She is a U.S. citizen with low income, has a part-time job, and has no insurance. She also meets a criteria of not having had an eye exam within 2 years. Therefore, you should connect her with Vision USA in addition to connecting her to Eye Care America. Provide her with the Vision USA 800 number and make sure she gives them a call. Remember that since it's Friday morning, Vision USA should be open, so there is no need to fill out the paper application. Also, don't forget to tell her about that free eye clinic in the area, so she has another option in addition. Let's review one last scenario. It is Sunday evening at a soup kitchen. You introduce yourself to a male community member and look at his background information form. You see that he is 46 years old, has not been to an eye doctor in 20 years, and has been diagnosed with diabetes. You learn that he has Medicaid. It is important that you explain to him that Medicaid covers eye exams, and that he should receive an eye exam regularly by an eye doctor, especially since he has diabetes. You should also explain that diabetes can significantly impact the eyes and that it is recommended that those with diabetes have an eye exam at least once a year. Fortunately, since he has Medicaid, he can use his health insurance to coordinate an eye exam by an eye doctor in the area. You don't need to connect him with any of the free health coverage programs since he already has health insurance. Both Vision USA and Eye Care America are programs for which being a legal U.S. citizen is a strict eligibility requirement. If you encounter anyone at your outreaches who is an illegal immigrant, you should make sure that they have the information they need to get to the nearest free clinic that provides eye care, because they will not be eligible for Vision USA or Eye Care America programs. At any given community-based program, you may encounter 10, 20, 30, or more people who need to be connected with free health coverage programs. It's vitally important that you go through this thought process with each individual that you encounter to ensure that they are each connected with the resources necessary to receive a complete eye exam by an eye doctor.